When you truly care about someone, what matters most is that they feel comfortable, safe, and deeply respected. Physical intimacy isn't just about pleasure, it's about understanding each other, honoring boundaries, and creating genuine connection. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon. And if you ever have questions or concerns about intimate health, I'm here to help you understand your body with clarity and compassion. Today, we're going to talk about something many people wonder about but rarely feel comfortable discussing: how to provide thoughtful, skillful manual stimulation to a partner with a vulva. I'm addressing this topic because, in my practice, I hear from so many people struggling with intimacy, worried they're not doing things right, unsure how to communicate, anxious about satisfying their partner. And here's what I want you to know. These questions aren't embarrassing. They're actually evidence that you genuinely care. This isn't just about technique. It's about how deeply you respect someone, how carefully you listen to their body, and how willing you are to learn what brings them comfort and pleasure. Your hands are among the most sensitive, precise instruments you have. They can adjust angles, modify pressure, increase from one finger to several, control speed, and move with either gentleness or firmness. This versatility makes manual stimulation far more nuanced than other forms of touch. Research shows that many women report satisfying experiences through manual stimulation alone. Medical studies indicate that a significant percentage of women consider manual touch during foreplay essential, and many can reach climax this way. Yet the challenge is that most men haven't had proper opportunities to learn this. What you see in pornography or exaggerated media bears little resemblance to reality. Real women's bodies and responses are far more complex and delicate. So today, I'm going to share medically accurate, practically helpful, and above all, respectful guidance. This isn't a checklist of tricks. It's a roadmap for understanding someone's body and mind and growing together in intimacy. The two essential foundations: consent and preparation. Before any intimate touch can be truly meaningful, two things must be in place: consent and preparation. Consent isn't a one-time question. It's asking clearly, "May I touch you here?" And keeping that conversation open throughout. Your partner should feel free to say stop, ask for more, or express discomfort at any moment. Consent is ongoing. Keep checking in. Watch for responses. Show respect. Questions like, does this feel good? Should I continue? Harder or softer? Might feel awkward at first, but this communication actually creates deeper intimacy. When someone feels respected, they can relax more fully and trust you with their vulnerability. Next comes preparation, which many people overlook. Trim your nails short and file them smooth. Sharp or rough nails can cause tiny tears in the delicate vaginal walls or vulvar skin. These micro-injuries might not hurt immediately, but can lead to stinging or infection later. Wash your hands thoroughly with soap and warm water for at least 20 seconds, between fingers, under nails, up to your wrists. Remove any rings. Rings can scratch skin and harbor bacteria in their crevices. If dryness is likely, have unscented water-based lubricant ready. Avoid scented or warming, cooling products initially. They can cause irritation. Lubricant isn't a luxury, it's essential. Many men ask, shouldn't she get wet naturally? But arousal and lubrication don't always match. Stress, hormones, medications, menstrual cycle, dehydration, countless factors affect lubrication. Using lubricant doesn't mean your partner isn't aroused. Clean hands prevent infection and micro tears. Lubricant reduces friction, creating a far more comfortable experience. These basics protect your partner's health and safety. First phase: awakening the whole body and building anticipation. Now let's begin properly. First, remember, female arousal isn't like flipping a switch. The whole body needs time to prepare. Brain, hormones, nervous system, circulatory system all must work together. So start somewhere other than the genital area. Kiss her. Gently stroke her neck, collarbone, inner arms. Lightly touch your lips to the area behind her ears, her nape, along her shoulders. Slowly caress her lower back, hips, outer thighs, gradually moving inward. Keep your speed slow and pressure gentle. This is crucial. As you approach the inner thighs, slow down even more. Don't rush. Many men move too quickly toward their destination, but this journey itself fuels arousal. Through clothing or underwear, press your palm gently. Hold for about 3 seconds. Release slowly, then press again from a different angle. Trace light lines along the underwear's edge with your fingertips. Move slowly along the borders, like drawing a map. Watch her breathing, if it deepens, if her belly rises and falls more noticeably, if her hips begin to shift slightly. These are green lights. Your goal is steady, playful pressure, applying and releasing to build anticipation. The almost touching, the uncertainty of intensity. This activates the brain and maximizes expectation. Don't think of this as stalling. It's fuel. This process increases blood flow to the clitoris, labia, and vaginal opening, making later sensations far richer. Medically, during this phase, blood rushes to the clitoral and vaginal tissues, causing engorgement. The clitoris contains erectile tissue. Like the penis, it swells and becomes more sensitive with increased blood flow. Vaginal walls also begin secreting lubricating fluid as blood flow increases, becoming moist and supple, ready to receive touch. This process needs time. Allow 10 to 20 minutes for adequate warm-up. Second phase, beginning external contact. Slowly, gently. When things feel sufficiently prepared, you can start external contact. But remember, sufficiently prepared is determined by your partner expressing or consenting, not by your judgment. With underwear still on, gently stroke the outer labia and inner thighs. Feel the warmth, shape, and softness through the fabric. When your partner explicitly consents to skin contact, use your fingertips to glide slowly along the outer labia. The outer labia are relatively less sensitive, making them good starting points. Then move to the inner labia, which are much more sensitive and delicate, requiring even gentler approach. Move very slowly here, exploratively, like carefully touching an unfamiliar musical instrument for the first time. Focus on the sensations in your fingertips, where is softer, warmer, more moist. Simultaneously observe your partner's reactions. Subtle trembling, changes in breathing, small sounds, hip movements, all provide information. Circle around the clitoral area, but don't touch the tip directly at first. The clitoris has a small head, glans, protected by a hood, and for most women, this head is too sensitive initially for direct contact. It can be uncomfortable or even painful, so start by gently stimulating around the hood. Light as a feather, then small circles, then slightly larger ovals. Lightly brush over the hood or gently push and pull it side to side. Keep pressure very light initially. You can increase later, but starting too firm only causes discomfort. Watch for breathing changes, hip movements, small sounds. These are your traffic lights. Deepening breath, hips pressing toward your hand, soft moans like, green light. Continue that rhythm and pressure. If her body tenses, hips pull back, or breathing stops. Red light. Immediately reduce pressure or change position. Third phase, adding rhythm around the clitoris. Now it's time to add rhythm around the clitoral area. While every woman's sensitivity differs, most prefer consistent, repetitive patterns over random poking. The brain recognizes and anticipates patterns, and that anticipation amplifies pleasure. Let me share some effective patterns. First, clockwise circles. Starting at 12 o'clock just outside the clitoral hood, move to 1, 2, 3, slowly completing the circle. Take about 10 seconds per rotation. After several rounds, reverse to counterclockwise. Second, vertical strokes. Start at the pubic area, glide down past the clitoral hood to the vaginal opening, then travel back up the same path. Apply slightly firmer pressure going down, feather light coming up. The contrast creates more stimulation. Third, figure 8 motions. Draw figure 8s centered on the clitoral hood, extending left and right. This simultaneously stimulates both labia and the clitoris. Movement should be smooth and continuous. Flowing curves work better than sharp, angular motions. You can also adjust finger count. If your partner wants broader contact, use 2 fingers together. Index and middle press together for larger surface area. For focused, precise pressure, use just 1 fingertip. Communication is vital here. Ask short, specific questions. Softer or firmer, faster or slower, higher or lower. These questions elicit more accurate responses than vague, "Does this feel good?" Specific choices are easier to answer precisely. Here's a crucial tip. When you get a good response, remember that pattern. Return to it a few minutes later and repeat exactly. The brain experiences stronger pleasure from familiar patterns. Structure it this way: exploration at first, variety in the middle, concentration on the best pattern toward the end. Fourth phase, internal stimulation, timing, and technique. When should you move internally? Many people get confused here. Wetness indicates arousal, but it doesn't necessarily mean your partner wants penetration. Lubrication is one sign of arousal, but you need to read the whole body's signals. Always ask, "May I go inside?" Or, "Would you like internal stimulation?" Be explicit. If you receive consent, apply more lubricant if needed and start with one finger. Never insert when dry. Even with natural lubrication, additional lubricant is safer and more comfortable. Apply plenty of lubricant to your fingertip and gently around the vaginal opening. Then very, very slowly glide toward the vaginal entrance. Angle matters. The vagina enters at a slight angle, not straight up. It angles somewhat backward, toward the spine, so tilt your finger slightly downward, toward the lower back, for a natural entry. Just inside the opening, at about the first knuckle, pause. This is really important. Around the vaginal entrance are pelvic floor muscles that tense and relax reflexively. When something enters suddenly, they reflexively tighten. Pausing for a few seconds gives these muscles time to relax. Encourage your partner to breathe slowly and deeply. Deep breathing naturally relaxes pelvic floor muscles. When you feel the muscles release, proceed slowly deeper, not in and out thrusting, but gradually advancing inward, pausing, then a bit more. Once fully inside, don't immediately start pistoning. Instead, make a slow come here motion toward the front wall. Curve your finger so your palm faces up, then move your fingertip upward toward the front wall, like beckoning someone with a come here gesture. This motion stimulates the front wall, applying pressure to sensitive areas. Angle and pressure matter far more than speed. Fingers succeed through precision, not velocity. While inside, explore gently in millimeters, up, down, left, right. The vaginal wall isn't uniform. Some areas are softer, some have more texture, some are more sensitive. Map it slowly, noting where responses are strongest. If you feel tension, if your partner's body stiffens or breathing becomes shallow, immediately withdraw slightly. Breathe deeply together, then return to external contact. Don't force continuation. Discomfort is the opposite of pleasure. Comfort and safety must come first for genuine pleasure to follow. Fifth phase, finding the sensitive front wall area. About 3 to 5 centimeters inside along the belly side wall, the front wall, examine this area. This region is commonly called the G-spot, though medically it's urethral sponge tissue, or anterior wall sensitive zone. Individual variation here is enormous. Some women respond intensely to stimulation here, others barely feel it. Both are normal. When aroused, this area's tissue may feel slightly spongy or textured compared to surrounding areas. It might feel somewhat firmer or have a ridged texture. Curve your fingertip there and try the come here motion slowly. Start very lightly, like knocking on a door. Observe the response. If your partner says, "Oh, there," or her body jolts, or her hips press toward your hand, remember that spot and keep focusing there. Gradually increase pressure, from light tapping to short stroking, then longer upward strokes. Only increase pressure when your partner requests it, or her body clearly leans in. Don't judge on your own. Most women prefer consistent, repeatable rhythm over force. Once you've found a rhythm, maintain it for at least 30 seconds to a minute. The brain learns the pattern and anticipates it, building pleasure progressively. Constantly changing breaks what's building. Consistency is key. Your other hand is free. You can hold your partner's waist, stroke her lower belly, gently caress her chest, or use your thumb to maintain external clitoral stimulation. This combined internal and external stimulation is called dual stimulation, or blended orgasm stimulation, which many women prefer most. Inside, use the come here motion on the front wall, while outside, your thumb circles the clitoral area with steady rhythm. Two simultaneous stimulations create far richer sensation and easier climax. Sixth phase, expanding to 2 fingers and coordinating movement. If your partner wants a fuller feeling, more substantial sensation, you can add a second finger. But don't do this suddenly. First, partially withdraw 1 finger, slightly twist, while bringing the second finger alongside, then re-enter together. Both fingers need ample lubricant. Enter slowly, pause at the vaginal entrance, wait for muscle relaxation, then gradually proceed. With both fingers inside, maintain the curved position so fingertips stay in contact with the front wall. Now, coordination matters. Inside fingers make small come here motions or small arcs, while your thumb or other hand maintains steady patterns around the clitoral hood. The 2 rhythms don't need to match. In fact, inside slow and deep while outside quick and light creates effective contrast. Small movements suffice. As arousal increases, large motions become less necessary. Pressure and consistency become key. Rather than deep in and out motions, maintaining pressure on the front wall while moving minimally is far more effective. 7th phase, adjusting pressure and speed near climax. As climax approaches, signals intensify. Hips press into the bed or your hand, breathing quickens and shallows, sounds deepen, thigh or abdominal muscles may tremble, hands might grip yours or the sheets, or her head might tilt back. This moment is crucial. If you found a speed and pressure that clearly works, absolutely don't change it. Many men think, I should go faster, or I should press harder at this moment, but that backfires. Maintaining that exact pattern to the end is most important. If your partner says, right there, just like that, consider it a lighthouse beacon, an absolute reference point. Don't change position by even a millimeter. Don't alter pressure or speed. Even if your arm hurts or wrist is uncomfortable, hold that position for those few seconds or minutes. Because climax happens when sensation builds continuously until crossing a threshold and exploding. If stimulation changes during that building process, the accumulation resets. Like climbing stairs 1 floor at a time, then suddenly dropping back to the first floor. Changing stimulation at the last moment often makes climax vanish. Maintain consistency while watching your partner's body ascend toward climax. Breathing accelerates, muscles begin contracting. Vaginal walls might rhythmically squeeze your fingers. That's the orgasm beginning. Even then, continue the same stimulation until climax completes. After climax passes, gradually reduce pressure then. Don't stop suddenly. Like music fading out, slowly lighten pressure while slowing speed, eventually transitioning to just resting your hands still. 8th phase, various modifications, many women enjoy. Once you've mastered basics, try some variations. First, hood strokes. Form a V with index and middle fingers, flanking the clitoral hood on both sides, then gently slide up and down. This indirectly stimulates the clitoral head through the hood without direct contact, especially good for those too sensitive for direct touch. Next, wave strokes. Starting from outer thigh, moving inward to labia to vaginal opening, sweeping down, then back out along the same path. This motion resets sensitivity. Continuous stimulation can dull sensation, but briefly moving elsewhere, then returning restores sensitivity. Try pressure holding. Place your broad, warm palm gently over the entire vulva and press softly. No movement, just warm pressure. This provides calming stability during overstimulation or rest periods between climaxes. It settles the body while maintaining contact. Experiment with angle adjustment. Placing a small pillow or cushion under your partner's hips tilts the pelvis, making the front wall much easier for fingers to reach. Especially helpful when wrist angle is awkward. Rhythm variation can be interesting. Try patterns like fast, fast, slow, or firm, soft, firm to add rhythmic variety. But attempt this only when your partner is comfortable and familiar. Starting with complexity creates confusion. 9th phase, thoughtful care for hygiene and comfort. Hygiene and comfort are absolutely essential from start to finish. I already discussed pre-contact preparation, but there are ongoing considerations. First, short nails, clean hands, and ample lubricant prevent micro tears. Vaginal walls are extremely delicate mucous membrane tissue, easily damaged by minor irritation. Damage causes stinging, bleeding, infection risk. Prevention is crucial. Second, if you touch the anal area, then return to the vulva or vagina, you must change gloves or wash hands completely. Around the anus are intestinal bacteria like E. coli. If these enter the vagina, they cause vaginitis or bladder infections. This is a very common infection route. Never use the same hand back and forth. Third, if your partner feels stinging or pain, stop immediately. Apply more lubricant and return to external contact. Sharp pain is never okay. Thoughts like, just endure a bit and it'll improve, are dangerous. Pain is the body's warning signal. Fourth, warmth or slight stretching sensations, pressure feelings. Continue these only when your partner says they're not uncomfortable. The boundary between comfortable and uncomfortable stimulation is razor thin. Keep checking and communicating. Fifth, when lubricant dries, reapply mid-session. No need for embarrassment. Lubricant enhances pleasure and protects safety. Dryness causes friction. Friction leads to discomfort and injury. 10th phase, post-intimacy conversation and aftercare. After climax, the body needs time to gradually return to baseline. This period is called the resolution phase, and how you treat your partner now significantly affects the quality of future intimacy. Immediately post-climax, maintain contact but lighten pressure. Suddenly withdrawing your hand or pulling away can make your partner feel abandoned. Rest your hand gently over the vulva, warmly cradling. Give the body time to settle itself. Many women appreciate being held after climax or having their ribs, back, or hair gently stroked. Light thigh massage works too. This contact communicates, I cherish you, we're connected. Offer water. The sexual arousal and climax process uses more energy than you'd think and can cause dehydration. Handing over a glass of water seems like a small gesture, but it powerfully signals, I care about your body and health. Later, when your partner is ready, ask just one brief question. What felt best? Or, what would you like to try next time? Listen seriously to the answer and remember it. Even write it down. That's your real manual. Your partner's direct preferences matter 1,000 times more than generic internet information. When receiving feedback, don't react defensively. Saying, oh, that wasn't good, in a hurt tone makes your partner hesitant to be honest next time. Instead, respond with, oh, I see, I'll try that next time, with gratitude. Sex is a learning and growing process. Perfection isn't required. Important truths. Many men don't know. Let me share some truths many men don't realize. First, not all women reach climax from internal stimulation alone, and that's completely normal. Research shows approximately 70-80% of women have difficulty reaching orgasm without clitoral stimulation. Those who climax from internal stimulation alone are the minority. That doesn't mean internal stimulation is meaningless. Many women experience the most intense pleasure when receiving both internal and external stimulation together. But if your partner doesn't particularly enjoy internal stimulation, that's not abnormal. That's just how her body works. Clitoral-focused stimulation alone can provide completely satisfying experiences. Second, the best method is observing, listening, and asking. The internet overflows with articles like 10 secrets to satisfy women, but honestly, those generalizations are 100 times less accurate than the real-time responses of the person right in front of you. Breathing, sounds, movements, words, these are all live feedback. Third, emotional atmosphere truly matters. When your partner feels safe, respected, and unhurried, bodily responses completely change. Blood flow and lubrication improve, pelvic muscles relax, and she can focus on pleasure. Conversely, anxiety, feeling judged, or feeling rushed causes bodily tension and pleasure blockage. So equally important as technique, perhaps more important, is atmosphere. Continuously sending messages like, you're safe, no need to rush, your pleasure matters, I respect your responses, both verbally and non-verbally. Fourth, everyone is different. Everything you learned today might not perfectly suit your partner. Some prefer intense stimulation, Others prefer feather-light touch. Some like fast rhythm, others prefer slow. There's no single answer. What your partner enjoys is the answer. Fifth, pleasure doesn't rise linearly. It moves in waves, rising and falling. So initially, strong responses might suddenly decrease. That's not because you did something wrong. It's just the body's natural rhythm. Don't panic, rest briefly, then restart or try different stimulation. Why communication matters most in relationships. Ultimately, the heart of this entire discussion is communication. The biggest barrier to sexual intimacy isn't lack of skill, it's lack of communication. Many couples stay silent in bed. They don't say what they want, what feels good, what's uncomfortable, because it's embarrassing, they fear hurting feelings, or they don't know how to express it. But your partner can't read your mind. No matter how long you've dated or been married, you can't know bodily responses 100% accurately. So you must speak. This feels good. I like this speed. A bit firmer. I want to rest now. You can start again. These short sentences completely transform relationship quality. When your partner expresses something, don't criticize or react defensively. Responses like, "Why didn't you say so earlier?" or "Was I that bad?" make them silent next time. Instead, "Thank you for telling me. I'll try that. Can you share more?" These responses open communication wide. Sexual intimacy isn't one perfect experience. It's continuous learning, adjustment, and growth. The 10th time can be better than the first, the 100th better than the 10th, because you understand each other progressively better. True intimacy begins with respect. I hope today's discussion brings someone practical, warm help. Hands are truly amazing instruments. Delicate, precise, warm, and capable of tenderness. When used with patience, accuracy, and genuine care, hands can simultaneously give your partner deep pleasure, security, and the feeling of being loved. Always remember, intimacy begins not with technique, but with respect. Even with perfect technique, without respecting your partner, it's hollow. Conversely, even with clumsy technique, if you genuinely care for and respect your partner while willing to learn, that creates far more meaningful and satisfying experiences. In healthy, safe relationships, every moment shared with caring hearts is precious. Perfection isn't necessary. Mistakes are okay. What matters is the willingness to keep learning, listening attentively to your partner, and the commitment to grow together. I sincerely hope you and your partner can respect and understand each other, sharing safe and satisfying intimacy. If you have questions or uncomfortable symptoms, please consult a urologist anytime. Your sexual health and relationship quality are precious enough to deserve care. May you care for yourself and your partner, and have a healthy day.